Hi, everyone. Welcome to the Northern Kentucky Spotlight Podcast presented by CVG. I'm your host, Sarah Brookbank. Today on the podcast, we are joined by Wendi Harris and Marietta Justice of Ellie Mental Health. They talk about how they are destigmatizing mental health issues and finding better ways to help the community. On NKY at Work, Nancy Spivey is joined by members of St. Elizabeth's Palliative Care team, and they talk about caregiver issues in the workplace and how employers can better support caregivers or those dealing with acute illnesses. Thank you to our podcast sponsors, CVG, our title sponsor, C-Crew Consulting, our digital sponsor, and our episode sponsor, Haran. Eggs and Issues is back in October. Join the Northern Kentucky Chamber of Commerce and Lee Kroom, President and CEO of BNKY, at Eggs and Issues on Tuesday, October 17th. Lee will moderate our panel featuring local experts on entrepreneurship, including Jill Morenz of Aviator Accelerators, Isaac Hamlin of Better Blend, and Jenny Albarani of Thomas More University. You can register now for that event at nkychamber.com/eggs or nkychamber.com/events. I won't keep you guys here long, so let's go meet our members of the week, hear from our sponsors, and Nancy and I will be back with today's guests.
Why would you travel to England?
For football.
To go or not to go?
That is an easy question.
To visit the land of Shakespeare.
To take in all the sights.
Authentic fish and chips.
To experience arts and culture.
2 words, British Open.
To visit my family.
Same reason I go anywhere. For a pint of beer. To start my trip through Europe.
Whatever your reason, there's no better time than now.
Ranking on Google Search and Maps is easy to understand, but hard to do. It requires constant effort and attention, uploading new photos, responding to Google reviews, writing weekly posts, and checking suggested updates. Google listing optimization takes experience and time, and there are no shortcuts. C-Crew gives your Google My Business account the steady, consistent attention it needs to be effective, optimizing, updating, and expanding critical content every single week. From local retail stores to large regional networks, C-Crew generates content, establishes benchmarks, and creates dramatic, measurable increases in engagement. So what can C-Crew do for your business? More calls, more clicks, more clients.
Congratulations to our members of the week. You can learn more about these businesses by following the Northern Kentucky Chamber on social media, where we will highlight one of these members each day. Now, let's meet our members of the week. Whether it's for an anniversary, wedding, or special gift for that special someone, Fort Thomas Jewelers carries a wide variety of the latest jewelry. Community Montessori provides an educational option in Covington that inspires children to grow toward their potential and to meet challenges of today's world with confidence, compassion, and grace. Athena Hospitality Group is a full turnkey hotel management company focusing on mid-tier and upper-tier branded hotels. Founded in 1893, Oswald Companies is one of the nation's largest independent insurance brokerage and risk management firms. Emerging Leaders of NKY is a nonprofit dedicated to supporting and developing young professionals across the greater Cincinnati region. Hi, everyone. On the podcast today, we are joined by Wendi Harris and Marietta Justice of Ellie Mental Health. Ladies, thanks for joining us.
Yeah, thanks for having us.
We're so happy to be here.
Yes, so we're going to talk about your services as well as your clinic, a lot of different things. But let's start out with, tell us about Ellie Mental Health.
Yeah, so Ellie as a whole is a franchise. So it was founded in 2015 by 2 therapists, Aaron Pash and Kyle Keller, when they first opened the first Ellie clinic in Minnesota. Since then, they've continued to grow with multiple different clinics all across the country. They were founded on the principle of destigmatizing mental health. As a clinician, the mental health field is full of barriers for clients to reach out for help. So we want to make it our goal to kind of fill in those gaps and fill in the barriers and break down those barriers for the communities that we serve. The main way that we do this is with humor. So we believe that struggling with mental health issues is 100% normal. Some days are great. Some days you wish you could dig yourself into a hole and hide from everything. And we want to make it known that everybody has those days, even your therapist. So we're not exempt from that.
And so for us as the owners, myself, my husband David, and my brother Mark and his wife Charlene, when we found Ellie, we felt like it was such a great way to serve our community. We've all had some experience with mental health issues that have needed addressed, and just the barriers that are there. Waiting long times, not getting the right therapist to fit you. And those are things that we felt Ellie really focused on to be able to help the community more. So it's near and dear to our hearts to be a part of this and help our community and be a resource to help destigmatize mental health.
Yeah, and you both have said that destigmatizing mental health, as someone who has struggled with mental health issues, has been in and out of therapy for years. It is something that I think in the past couple of years, that idea of destigmatizing, reaching out for help, has really come to the forefront.
Yes, for sure.
Yeah, we are so thankful. When I started in this, career path 10 years ago, it was something that people were sometimes ashamed to come to therapy. They were like, my partner or my family doesn't know that I'm coming, because mental health is something that we don't talk about. And I think over the last 10 years, thankfully, there's been a shift in that, and there's such a change where people aren't afraid or ashamed to reach out for help, which is wonderful. As a clinician, I think everybody needs therapy, so I'm so glad that it's becoming more of a norm conversation.
Yeah, I agree. I think definitely everybody should go to therapy at least once and try it. Yes. And speaking of therapy, tell us about the services you all offer.
So we have a lot. I've kind of made some notes here so I don't forget anything. But we do individual therapy, we do family, we do both in-person and telehealth. We do marriage and couples counseling. As far as age ranges, we see ages 4 and up. Some of the specialties that our clinicians have are in anxiety, depression, trauma, grief and loss, personality disorders, mood disorders. There is LGBTQ and BIPOC identified and competency clinicians. And then we also have clinicians that are trained in modalities as far as like EMDR, which is very specific and very unique and works very well with people with trauma. We have people that are trained in DBT, CBT, and then TF-CBT, which is kind of, again, like a trauma-focused CBT. So there's a whole lot of things that we offer.
Yeah, it seems all-encompassing.
Yes. Yeah. We try.
Yeah, and you guys have a couple of locations locally, so where can people find you? Or you're working on opening locations?
Say, we do have plans for our second. We will actually have 4 altogether. We have one clinic right now on Thomas More Parkway at 350 Thomas More Parkway and in Crestview Hills, and then we will be opening another clinic in Northern Kentucky, and we're still looking for a location for that. Our goal is to be maybe Newport, Bellevue, Covington area, but we will just have to see where we find the best location for our clinicians as well as our clients. And then we will open 2 more in Northern Cincinnati, so Mason, Liberty, that type of area. So yeah, we'll have 4 altogether.
Yeah, that is very nice. So you guys are growing. And you guys also work with a lot of community partners. So kind of touch on the work that you guys are doing in the community and the work that you guys are doing with people outside of your internal organization.
Yeah, so I think it was, probably a month ago, we had a big push on outreach meetings. So we met with folks from Northern Kentucky University, Thomas More, some local doctors' offices. We partner with the first responders. So myself and then a couple of our other clinicians are being vetted with the first responders just to make sure that there's that cultural competency, because as we know, their jobs are totally different and they are exposed to a lot of trauma.
Yeah.
So we've been participating in some ride-alongs with EMS, and then we're hoping to work on partnering with local schools as well, local elementary schools.
Yeah, it's very exciting. Why are you guys doing that? What is making you guys want to partner with other organizations?
With the first responders especially, I think in that area, there's been a lot of barriers and, being kind of looked down on of if somebody were to reach out for help. So we want to be able to be that person that's non-judgmental, that's not, just very easy to talk to, easy to get to know, and get the help that you need. Their jobs, again, are very traumatic, so just not shoving that inside and not dealing with it. And then we want to be known to local schools, so that way if people are getting ready to graduate, then we want to be available to, hopefully work with them about a job and just kind of get that experience. And we're just very passionate about helping our community. So if there's something that we don't offer that we find out that's beneficial, then we take a look at that and can try to hire based on that and look for people that can fill that area.
Definitely, we want to be a part of the community. We want to better the community, and we want people to realize that this is a good thing for you to go and do. Our physical health is always, right there on the forefront, but our mental health is just as important. And so we really want to make that easy for the people in our community to find a place to get the resources they need.
Well, that is awesome. I'm sure that is so great for the people that you serve and getting out to more people that maybe haven't used services before. It feels like that's something that's a little bit different than what maybe a standard therapist's office or mental health office would do. What else do you guys think really makes you guys stand out?
Yeah. So I've worked in a couple of different areas throughout my career, and when I came across Ellie, I hadn't heard of it before. I checked out their website, and it was completely unlike anything I had seen before. It was so fresh and new and modern, and just with the core values that we have, that stood out to me. As far as our offices, they are very warm and inviting and welcoming. It's almost like a home atmosphere. We have like a blue and a gray kind of color, just very warm, calming. Our offices have couches in them, so that way it's not as like stiff and, therapeutic, I guess, per se, that when people expect that, we want it to be something unexpected, and just to have that atmosphere of people relaxed. And then we also are different in the fact that we have what's called an Ellie match system. So when clients call our intake line, they can let our intake people know kind of what they're looking for, why they're seeking therapy, if there's any, if they want a certain gender, if they want a certain age range of a clinician. And on our end, we have a profile that lists the age ranges that we want to see, the treatment modes that we use, the different specialties or training that we have. So then that way, when somebody calls in, we can get matched with the client. So then that way, our hope and our goal is that even after taking that first step, which is so daunting, that after that, they're more willing to keep that first appointment. And we also reach out to people at least 48 hours before their appointment just to introduce ourselves, remind them of their appointment, and just, thank them for reaching out for help. So we just hope that that's lessens some of the nervous energy about coming into our office.
Yeah, it definitely is something that is hard for people to take the first step. And so we want to make it as easy as possible for them, as comfortable as possible for them. And also that when they come in, they can be matched with someone right away that can help them versus someone who may not be able to help them with their certain needs. And so this takes away that question of, oh, am I going to really get help from this person? So Ellie was really, really thoughtful in making that a part of their intake so that when people call, they don't have to worry about those little like, oh, what if I get somebody that's, totally not relatable at all? Or, they're going to have that opportunity to know. And then the call just gives that warm, introduction. So they're not like, I haven't even talked to this person. Who is this? It just gives them that little bit of extra comfort.
You said taking down that barrier. As someone who's been in a therapy setting and then like bounced around, like had that first intake appointment, and then you've got to go see somebody else. And you have to go through the whole thing all over again. It's not fun, especially when you're dealing with heavy stuff like your brain being partially broken, or anything else.
Yeah, and that's why we just think that the profile, especially to have a clinician, that clinician is specialized and has experience in that area. So it's not like, you have say grief and loss, and you're seeing this therapist and they don't have any training or any experience in grief and loss, that you're seeing someone that has that area on their heart and has that training and experience.
Yeah, that is very important. And you mentioned core values for Ellie. So let's touch on those, because I know those are obviously core values.
Yes.
Yeah, so Ellie has certain core values that they just do all of their business by: creativity, humor, determination, authenticity, acceptance, and compassion. And I think all of those things are so important. You can't even, we always try to ask people what resonates with you the most, and it's so hard because all of those things are so important with mental health. So we just really appreciate that Ellie found these as being the basis of their company.
Yeah, that is very cool, especially the humor part.
Yeah.
I think that so many of us use making a joke or trying to laugh it off as a way to cope with the very serious issues that everyone has to deal with every day. And then how can people, if they've listened to this conversation and they're really interested, how can people get in touch with you guys and maybe take advantages of your services?
Yeah, there's a couple different ways. So we have a website. If you Google just Ellie Crestview Hills or Ellie Mental Health, then on the website there's a location finder. Then when you get to our location of Crestview Hills, you can see all the different services that we offer. You can see the different clinicians that we have. There's a picture of each clinician and then a little bio, so you can kind of read and get to know them a little bit more. So then even if you read over that, and when you call in, if you have a clinician in mind, then you can let that intake person know. There's a form on the website that you can fill out, and our intake team will reach out to the client to schedule an appointment, or you can call our intake line directly. That number is 859-600-6990.
That's great. Anything else you'd like to add about getting in touch with you guys?
No, I think that she covered everything. The phone number is there. The website is there. It's very easy to find and use. And that's another good thing, when you're looking, should come up right away. So just look for Ellie Crestview Hills, and it should be pretty easy to find us.
Well, good. And then before I let you both go, thank you so much for your time today. Is there anything else you guys would like to add about your business for our viewers and listeners today?
I think one thing we didn't talk about was insurance. So we do offer a self-pay rate. We have a sliding fee scale. And then we are also accepting Humana, Cigna, CareSource, and Optum insurance. And then some insurance providers are taking a little bit longer than others. Anthem has been a huge request for us, but that is in the works. We're hoping within the next couple of weeks we get the green light on that. And then we're also waiting on Aetna, TRICARE, and MedBin, which MedBin is what the first responders use. So we want to be available to them.
Yeah, very great. Anything else to add on your end?
We just want to help the community, and we're so glad to be a part of the chamber and be a part of the community here in Crestview Hills, and can't wait to grow.
Right. Well, thank you guys so much for being on the podcast today. I appreciate it.
Thank you so much.
Hi, I'm Nancy Spivey, Vice President of Talent Strategies with the Northern Kentucky Chamber of Commerce. And joining me today on the NKY at Work segment are members of St. Elizabeth's Palliative Care team. Welcome. Let's start with introductions. Go ahead, Lacey, introduce yourself.
My name is Lacey Lykins. I am a social worker on the palliative care team at St. Elizabeth Hospital.
And I'm Jennifer White, and I'm a nurse practitioner on the hospice team and the palliative care team.
So for people that don't know what palliative care is, can you give me a definition and help me understand the difference between it and hospice care?
All hospice is palliative care, but not all palliative care is hospice. So what that means is palliative care is best suited for people when they have a serious illness and they really need the support of our team to help them with the psychosocial issues that they're having dealing with that serious illness, the symptom management, because there's lots of side effects, obviously, when you have a serious illness. And then the social issues too, and there's spiritual issues, which is why we have a chaplain, we have social workers on our team, for instance, Lacey, she's a social worker. So those are all things that people with a serious illness need, and you can have palliative care along with your primary care, your specialists, and if you're seeking active treatment for whatever disease process you have, then you're still going to have palliative care at the same time. Hospice is reserved for that period where you might be told you have about 6 months or less as far as a prognosis. And at that time, you might think about maybe it's time to focus more on my quality of life and not so much on my quantity of life. And so that's when we start thinking about maybe it's time to discuss with the patient and the caregiver or family, whoever it might be, let's talk about hospice and see if that's a good fit for you moving forward. Now, when people are enrolled in hospice, that typically means that they're no longer going to seek that aggressive treatment like you see with palliative care. So they're not going to be going to all their other healthcare providers and their specialists. So that's a big difference between hospice and palliative care.
Okay. So let's focus on the workforce end of things for a moment. Let's talk about individuals like myself that's caring for an elderly parent, or others that are out there caring for individuals that are in need of palliative care. What role do you play? How does that work? Help me understand what's going on here locally and in Kentucky.
So in Kentucky, in northern Kentucky, we have palliative care here. We have the palliative care that rounds in the 3 major hospitals in northern Kentucky for St. Elizabeth. So we have it at Fort Thomas, at Florence Hospital, and then at Edgewood Hospital. We don't currently round at the Covington locations. That's more of like an emergency department, medical office buildings. And then we don't round at Grant County yet. We just acquired, as you know, like Dearborn. That we're looking towards in the future, but we currently don't round out there either. So.
Okay. And is it on the uprise? What's the population of people like myself that is dealing with caregiving issues in the workplace?
Yeah, so statistically in Kentucky alone, about 13% of just normal adults that are out there walking on the streets are unpaid caregivers. So they're taking care of their parents, they're taking care of their in-laws, or grandparents even, or living in their home because they're trying to prevent them from having to place them in a facility or for whatever reason. So, but they're also having to juggle their jobs, their careers, their family lives, and all that, and it's a lot.
It's a huge challenge, and I know as a social worker, you're probably seeing it day in and day out. What do patients say, or those who come to you for support? What do they say that they need?
Yeah, we see a lot of obviously patients who are in crisis because of their acute illness, but what we sometimes fail to recognize is the caregivers who are in just as much crisis as the patient is, because they're dealing with their loved one in this acute illness, but they're also dealing with what's going to happen down the road. What does that mean for them as a caregiver? What does that mean for the parent that they're watching, suffer from this illness or deteriorate from this illness? The emotional and psychological and financial impacts, just to name a few, are just completely overwhelming to these families at times. And while, the patient is always our primary concern and the person who is, at the forefront of our treatment plan, we also have to consider who their support giver or their caregivers are, and really kind of explore what that person needs in order to provide the best care for our patients. And so that's where palliative care is very important for patients, because we can really not only treat the patient and what they're dealing with, but also their family system as well, or their caregiver system as well.
And does it work so that if I'm diagnosed with an acute illness, would my doctor refer me to you? What's the process to get into the caregiving situation?
So if a patient is diagnosed with a chronic or terminal illness, and they are wanting to continue to seek curative treatment, palliative care is there for that. You can be referred by a physician. You can be self-referred. You can receive those services inpatient at one of the St. Elizabeth hospitals, or we also have an outpatient clinic as well. And your referrals can be reviewed by a physician there at the clinic to determine if our services are what best fit your needs.
Okay, and is this in-home? Is it in the office? Let me understand the structure.
So right now, our palliative care team focuses in the hospital and in the outpatient clinic as well, which is housed in the cancer center at Edgewood. Currently, there is no home-based palliative care at St. Elizabeth, but there's always a need for palliative care, and as our population continues to age, and as we have more and more family members who are providing care to their aging family members, those services are going to be needed and required. So palliative care in Northern Kentucky will only continue to grow, but also across our nation as well.
Anything you want to add to that?
I think she said it all.
Perfect. So who's eligible for palliative care, and how can I benefit from our listeners' viewpoint? What's the benefits?
So, like she mentioned, it's not if you have an acute illness that makes you eligible. It's more for a chronic illness or like something that would be considered a terminal condition. Serious. We typically say a serious illness is how we say it in palliative care. So if you have something, for instance, these are examples, like if you were to have cirrhosis of the liver or end-stage heart failure, stage 3 or above. If you have heart failure, you might understand the stages, so that would make sense. Any kind of cancer, because along with aggressive treatment of cancer comes side effects, and that's where, because I actually work in the cancer center, and I treat a lot of patients for their symptoms related to that kind of thing. So, I'm trying to think, but we do have some patients that we see for neurological symptoms of their ALS or their MS, that kind of thing. That's about it. Yeah. So basically, any serious illness is what we would see a patient for in palliative care.
Okay. Let's talk about advanced care planning. That's a term I'm not familiar with. Help me understand what that is.
Sure. So advanced care planning is an ongoing process. It's a process of reflection and communication. It's a time for you to reflect on your own personal values, your wishes, your beliefs, any kind of limitations that you have as far as your healthcare goes. We know and recognize that a patient's values and beliefs and what their wishes are all impact medical decisions and healthcare decisions. It impacts their hospitalizations. It impacts what they want their life to look like if, God forbid, something would happen and they would be diagnosed with a chronic or terminal illness. When we talk about advanced care planning, and we do that very frequently if you're in the hospital and we come to see you, you're going to find that we explore the completion of a living will. That's something that is going to be very important for caregivers. It's important for everybody to have a living will. I myself have a living will. We encourage everyone over the age of 18 to have a living will. It really just allows you to talk about what you would want if something, God forbid, would happen, and who you want to make those decisions on your behalf. A living will allows you to tell your loved ones how you wish to be taken care of if you ever suffer a terminal illness. Do you wish for your life to be prolonged on machines? Would you ever consider a feeding tube if you ever needed that? These are questions that you can boldly outline and answer with the completion of this document. Advanced care planning discussions are often we often explore a patient's wishes regarding resuscitation as well. So that's also a huge part of advanced care planning. You'll hear phrases like, would you like to be a full code, or do not resuscitate? These are deeply personal decisions, and they should be part of your discussions with your loved ones and those that you are designating to make healthcare care decisions on your behalf as well. Everybody approaches these processes differently, so be flexible when you're having these conversations. Take it one step at a time. Start small. For example, simply try talking about with your loved ones what's important to you, what you appreciate most about your life, how you would want your life to look like in an elderly state or in a state that you did rely on others for caregiving services. Your values, your treatment preferences, and even the people you involve in your care might change over time. So these are conversations that you should continue to have. The most important part about advanced care planning is just simply starting that conversation, because these conversations are very difficult and they do make people uncomfortable sometimes. But your wishes can't be honored, and nobody has any idea of what those might be unless you talk about them.
Yeah, great information and insight. So how do I find out more? How do I connect with palliative care?
So you can have your physician consult us if you're ever inpatient, like in the hospital, already hospitalized. They can send a referral to the palliative care team, and then when we receive that, we'll send members of our team to see you and help you in any way we can. We explore all those things that we talked about earlier, the social, psychosocial, spiritual, and the symptom management piece. Or if you need to be seen in an outpatient setting, then they can send a referral to the outpatient palliative care clinic. And that can all be done, in Epic, which is our computer system. So
perfect. Anything I've forgotten to ask? Anything you want to add?
I don't think so.
Thank you both for coming in. It was very valuable.
Thank you.
Hi, I'm Shannon Schumacher, Account Executive, Kentucky Market Leader. At Haran, we champion bold innovation to help employers and individuals thrive. As an industry thought leader, we explore new horizons in healthcare, benefits, employee engagement, and wellness. We work harder to deliver all the strategic benefits, planning, and execution you expect from a true partner. And we do it with laser focus on your short and long-term outcomes to help manage your benefits while improving your employee experience.
Welcome back, everyone. I hope you enjoyed today's very healthcare-focused episode of the Northern Kentucky Spotlight Podcast, where we heard a little bit more about Ellie Mental Health and St. Elizabeth's palliative care team. Don't forget that you can register for October's Eggs and Issues on Entrepreneurship at nkychamber.com/eggs or nkychamber.com/events. That event is happening on Tuesday, October 17th. Thank you once again to our podcast sponsors, CVG, C Crew Consulting, and Haran. I would also be remiss to end this podcast episode without thanking everyone who joined us for annual dinner in September. It was such a great night celebrating all the businesses and individuals in Northern Kentucky that are helping us move forward as one. You can check out our website or our newsletter to see the recap article from that event. Once again, thank you to all of our attendees and sponsors for annual dinner. Finally, if you are a member who would like to be featured on the podcast, or if you're someone who is interested in joining the Northern Kentucky Chamber of Commerce, please reach out to Lynn Ablin. And if you're a member who would like to share your workforce strategies and resources on NKY at Work, please reach out to Nancy Spivey. You can find their contact information on the screen in front of you or at our staff directory at nkychamber.com. Thanks again for tuning in. I'll talk to you all next week.